Well, Aaron, as we've reported for months now, the health data, it is crystal clear that Black Philadelphians, they're more likely to get COVID-19, they're more likely to die from COVID-19, but they're less likely to be tested for it. Now, the reasons for this, they have much wider and long-lasting implications than even the start of this pandemic. The lines to get a COVID-19 test snake through Philadelphia's church parking lots. Waiting in lines like these are people like Toby Downing.
In the community I live in, I didn't have access.
Before the pandemic, financial constraints already forced a disproportionate number of minorities to live in areas with few grocery stores, higher levels of air pollution, and a lack of health care access. Medical studies from MIT show this reality led to more chronic health problems like diabetes and hypertension, not because minorities are more prone to poor health choices, but because they couldn't afford to choose.
I absolutely believe that the job that I have allowed me to be exposed, and I believe that the community I'm living in was one of the reasons why I didn't have testing available to me.
Tuesday, during a virtual city council hearing, the founder of the Black Doctors COVID-19 Consortium gave an obvious but overlooked example of racial bias built into the testing system.
I don't know if you can see this, but this was just yesterday, and it says must have prescription note and must have ID. What does the ID have to do with you testing someone for coronavirus who thinks they may be exposed? The hours are 9 to 5. There are no hours on weekends. How are people supposed to get tested?
Minorities are more likely to work non-business hours. They're less likely to have a government-issued ID like a driver's license or passport.
I do think that Dr. Stanford raises some important points. We want those testing sites to be as accessible as possible. I was unaware until she raised it with me, the idea that there was a need to have ID. That's definitely a barrier that shouldn't be there.
It's one of the reasons Philadelphia's health department is launching a plan to reduce racial inequities. Priorities include improving access to testing for communities of color, increasing inspections and enforcement of unsafe working conditions for essential workers who are disproportionately minorities. The city will also scale contact tracing in minority neighborhoods by hiring minorities to do the work.
African Americans have higher mortality rates than whites for a wide range of diseases and injuries, heart disease to diabetes to homicides. These disparities are one result of structural racism in our society that reaches back across generations.
Now, here's a stat that pops out. For every one white person who has died in Philadelphia from COVID-19, 1.5 Black people in Philadelphia have died from the virus. Again, the health data, it shows these outcomes, they trace back to intrinsically biased and often racist health and government systems that often have these unintentional consequences for minority communities, guys.
All right, Mitch Blacher reporting live tonight with some important disparities to keep in mind here as we continue to talk about the coronavirus.